Okay, so we are going to be reading over the Putting It All Together case study for Peds. This is a school nurse, a middle school student with ADHD, type 1 diabetes, and we're looking at social determinants of health. Social history, you are a nurse practicing in the school setting in a rural Title I community. It is the beginning of the school year, and one of your 7th grade students on your caseload is a 13-year-old student named Aiden. Aiden is an only child in a single parent household. Aiden's grandmother was living with Aiden and his mom until she passed away in July. Aiden's mom is a local retail grocery assistant manager and works evenings and weekends. Aiden receives free and reduced meals and eats both breakfast and lunch at school daily. His breakfast is at 7 a.m. and his lunch at noon. Aiden is an overall strong student and very social and has a specific learning disability called dyscalculia.
Medical history and current health status. Aiden is an otherwise healthy child who is fully vaccinated and diagnosed with both attention deficit hyperactivity, ADHD, and type 1 diabetes, T1D, in early elementary school. Aiden is able to provide a lot of self-care with his diabetes management, and you have delegated some of his daily care to an unsolicited assistive personnel, UAP. Aiden has an insulin pump and a continuous glucose monitor, CGM. His pump has a basal insulin level set at home, and he receives mealtime boluses at school. Aiden's mealtime insulin cover ratio is 1 unit per 12 grams of carbs. His blood sugar correction dose is 0.5 units of insulin for every 50 milligrams DL over 150 mgdl. Aiden also takes his methylphenidate 30 milligrams PO at breakfast and 20 milligrams PO at lunch. History of present situation. You have only worked with Aiden 1 year previously, and his glycemic control had been fairly stable. Last September, when you checked in with mom with the start of the year care planning, his hemoglobin A1C was 7.0. You recall that the end of school year was a little less stable when his grandmother was placed on hospice, and Aiden missed a lot of school and had to be reminded to report for medications before meals several times. You have noticed since school started this year that his blood glucose has been elevated each morning despite having a continuous glucose monitor with alarms.
So, presenting situation, it is Monday morning and you receive a call from your delegated caregiver that was supervising Aiden's breakfast insulin bolus, and Aiden's CGM is reading over 400 with the trend increasing. He denies abdominal pain or nausea. You advise that his bolus is administered as you are just walking into the health room. You begin interacting with Aiden. You have him double check his blood glucose. With the finger stick, he is reading almost 500. You have him check his ketones as per his school's diabetic orders, which are trace. He continues to deny any symptoms other than a slight headache. You double check Aiden's insulin pump, and his pump and tubing is intact and patent, and his basal insulin is running. Upon further assessment, you find that Aiden has been estimated his carbohydrates for his dinner bolus every night based on whatever my lunchtime carbs were, stating he never really got the hang of counting carbs because my grandma always did it for me, and they were always calculated at school. Aiden further states that his mom is working most evenings and sometimes forgets about his dinner dose completely. He states he is unsure if he took any insulin last night. When you ask about his alarms on his CGM, he states that he silences them often because they are annoying. After speaking with Aiden for a bit about his blood glucose is trending downward and he is drinking clear liquids and continues to be asymptomatic, You have him go eat breakfast and tell him you would like him to come back to the office after breakfast so that you can further talk. He agrees. When you call his mom, he states that things have been very stressful since her mom passed away, and bereavement leave was only a few days, and states that they do not have any additional family here. She also notes that Aiden and his grandma were very close, but he doesn't share his feelings. She states that Aiden is forgetful and that he doesn't like math but should be able to calculate his own carbohydrates. She further said the doctor just talked to him about this. When you call his endocrinologist, she shares that Aiden's hemoglobin A1C was checked last month and was 12. She is concerned about the family and discusses further support. So, to continue on with the questions, what further assessment questions might you ask Aiden when he returns?
So we would ask Aiden to show us how he counts his carbohydrates for the meal and assess if he is doing it right. We would ask, can you walk me through your routine for giving insulin at dinner? We would want to ask, can you tell me more about silencing the CGM alarm? What makes it annoying? And we would also want to ask, how have you been doing since your grandma's passing? These are all important questions that we can get some more information on. We can assess Aiden's knowledge about what he knows about his giving himself insulin and his carb counting, and try to see how he is doing since the passing of his grandma. And that was from Scannell and Ruggiero 2022.
Okay, and what patient problems are immediately identifiable in this situation?
So some problems that are immediately identifiable are that he has hyperglycemia and his blood sugar levels are 500, which is quite high. He has poor glycemic control as his hemoglobin A1C is now at 12 when it usually being controlled should be below a 7. He has education deficit in carbohydrate counting, so he is not getting the count correct, causing the insulin to be wrong. He did not learn properly how to do this before his grandmother passed. He's having inconsistent insulin administration since he's not counting his carbs correctly. He's not giving himself the correct amount of insulin. He is also not consistently giving his insulin. He's often forgetting to give it. And this was from Scannell and Ruggiero 2022.
And how would you prioritize addressing these problems and why?
I would prioritize them as number 1, his hyperglycemia, as this needs to be addressed first because it's happening right now in the moment, and it is the most dangerous as it could cause him to become very sick, and we need to get his blood sugar levels down. Then I would want to address his poor glycemic control. This will be addressed second, as this can cause hyperglycemia, which is the most dangerous aspect here. And then 3, I would address inconsistent insulin administration. This will be addressed third, ensuring that he has a reliable system for administering his own insulin on time will prevent hyperglycemia. And then 4th, we would do education deficit in carbohydrate counting. This will come forth as this will be vital to help him manage his diabetes and know how much insulin to give. And this was from Scannell and Ruggiero 2022.
Okay, and how might these problems impact him in the long term in his health?
So uncontrolled diabetes can lead to many health problems. These can be things like retinopathy, nephropathy, neuropathy, and cardiovascular disease. Uncontrolled glucose levels can also cause DKA, which is diabetic ketoacidosis, and this can put the body into shock, potentially being deadly. And this information was from Harding et al. 2023.
What does Aiden's dose of methylphenidate suggest about his ADHD?
So Aiden's dose of methylphenidate suggests that he is requiring almost the max amount of medication to manage his ADHD. The optimum daily dose is 2 milligrams per kilogram per day. We don't know his weight, so we can't say for sure what his correct dose would be, but we do know that a child should not go over 60 milligrams a day. And since he is taking a combined total of 50 milligrams a day, we can infer that his ADHD symptoms are significant enough that he requires almost the max dosage of medication to manage the symptoms. And this was from Lippincott Advisor. No date.
So, what potential social determinants of health or environmental factors are identifiable in this case study?
So one of the ones is economic stability. Since Aiden lives with his mother, who is a single parent and has a single income, Aiden also receives free and reduced meals at school. Both of these two things can suggest that they are living in a low socioeconomic status. There's also the matter of the healthcare access and quality, because due to his mother's work schedule, it can limit her ability to help manage Aiden's care with his ADHD and diabetes, and it can also limit her time to get Aiden to his appointments to help manage his conditions as well. Education is also identifiable in this situation, as he does have dyscalculia, which is a learning disability that impairs the ability to understand or recognize numbers, which can affect managing his diabetes, since he needs to calculate his carbohydrate intake and how much of an insulin dose he needs. Also, social and community context. Aiden has recently lost his grandmother, whom he was very close with, as she was his primary caretaker and support when Aiden's mom is at work. And he has not spoken about his feelings about the loss of his grandmother. And we can also identify in the situation, neighborhood and built environment, as Aiden and his mother are based in a rural community. This can limit access to specialists and other resources that can further manage his conditions. And this information came from Healthy People 2030, No Date, and Scannell and Ruggiero 2022.
So, given Aiden's environment, his diagnoses, and his biological age, what are some possible contributors to his deviation from his care?
So Aiden has a cognitive developmental factor that is a contributor to his deviation of care. This is ADHD and dyscalculia, as it can challenge him in focusing on calculating his insulin doses and calculating his carbohydrate intake, as he is now responsible for this task outside of school, since his grandmother is no longer there to do it for him. Aiden has not shared his feelings on the loss of his grandmother, which may be his way of grieving and dealing with his emotional stress. And this grieving this grieving can affect the way he manages his symptoms at work when his mom is at home when his mom is at work. Since his mother works evenings and weekends, this can deviate Aiden's care, as she is not there to help manage his diabetes effectively or help him or teaching him on how to do it on his own. Aiden's inability to manage his own conditions can also contribute to the deviation of his care, as he was always reliant on his grandmother. He has his learning disability. He's possibly grieving, which can lead to the neglect of his care, such as turning off his CGM alarms. Also, having a stressful life event like a loss of someone important to his life can worsen diabetes by stimulating the nervous and endocrine systems, that increase blood glucose and can develop maladaptive behaviors such as neglecting his own care. And this comes from Child Anxiety Counseling in Davidson 2022 and Scannell and Ruggiero 2022.
So what are some evidence-based tools that can be used to support Aiden in improving self-efficacy?
So some tools that can help improve Aiden's self-efficacy is using special educational opportunities, which can be given by the school for his learning disabilities associated with ADHD and dyscalculia. Another tool is creating and keeping a diabetes management notebook or digital tracking app to record the dates, glucose readings, insulin dose, and time, injection site, and who gave him the injection, so himself, his mom, or the nurse at school. Cognitive behavioral techniques can also be used to manage stress after loss of his grandmother and added responsibility of managing his diabetes. Peer contact and schoolwork to promote cognitive and social growth and development to avoid social isolation and identify school support needs. And this comes from Scannell and Ruggiero 2022.
And what are some family-centered interventions that can be employed?
So we can provide Aiden and his mother with education on diabetes management. This can help them establish routines and tracking tools for Aiden when she is not at home. We can offer grief counseling for both Aiden and his mother to address their recent loss, and it can help process the situation and their grief to reduce the stress of their life changes. Furthermore, we can work with Aiden's teachers to create a more structured and supportive plan of care to ensure adult supervision. This provides a collaborative opportunity just to ensure that both Aiden and his mother feel supported. And then lastly, we can also connect Aiden and his mother to local resources such as social services to help alleviate stress and provide additional support wherever needed, emotional support, financial support, anything like that. And this comes from Scannell and Ruggiero 2022.
Great. And what are some potential patient-centered education topics to address with Aiden?
So the first one would be counting carbohydrates. We need to educate Aiden about the importance of counting carbohydrates for each and every meal. We need to explain that the amount of carbohydrates in his lunch may be different than the amount of carbohydrates in his dinner, and that this is going to change the amount of insulin that he's going to get for each meal. We can provide Aiden with visual aids that consist of pictures of different common foods he eats and the estimated amount of carbs in each food to account for his dyscalculia. The next thing that we would want to, another topic for education for Aiden would be his CGM alarms. Again, for the importance, we need to educate Aiden about what the CGM alarms mean, which is typically his blood sugar is either too high or too low and it needs to be checked, and how to respond to the alarms appropriately. This would include teaching Aiden about what numbers would be considered too low and what numbers would be considered too high. We would also want to ensure that Aiden understands that the alarms are set there to help him manage his diabetes independently. We want to make sure that he's not silencing these alarms, as that could be very detrimental to his health. Another topic of education for Aiden would be insulin management and independence. Using visual aids and videos, we can explain the importance of managing diabetes with insulin. We can discuss with Aiden the complications that may arise if Aiden does not manage his diabetes with insulin, with the proper dose of insulin. And those would include hyperglycemia, hypoglycemia, and diabetic ketoacidosis. And we definitely want to encourage Aiden to manage his diabetes as independently as possible, as we are aware that his grandmother definitely had a big impact in managing his diabetes. So we want to make sure that we are fostering a very supportive environment for him to become a little bit more independent when it comes to managing that. The next topic for education would be centered around emotional support. We want to encourage Aiden to discuss his feelings regarding his grandmother and her recent death. We want to ensure that Aiden understands that his feelings are normal and expected. We want to create a calm and comfortable, open environment for discussion and discuss with, we could also discuss the potential of Aiden meeting with a counselor, possibly a school counselor or a counselor outside of school, so that he is able to talk more freely about his feelings surrounding his grandmother's death. And the last topic for education would be centered around a reward system. This may be really helpful to put in place to help entice Aiden in managing his diabetes independently. This could be with a reward system like treats for carbohydrate-free treats, for being able to count his carbohydrates during lunch, or it could be like a sticker book, any type of reward system. The information I used for this section is from Witzel et al. 2018, Meeting the Needs of Students with Dyslexia and Dyscalculia, and Scannell and Ruggero 2022.
And who are important individuals to coordinate with on care planning for Aiden?
So the first individual that I put for coordination for Aiden's care plan is his mother. It is absolutely imperative to ensure that his mom understands the entirety of his care plan, including his insulin schedule, his insulin dosing, the parameters for that dosing, and Aiden's ability to manage his diabetes independently. It's also really important for Aiden's mother to be able to calculate his carbohydrates as well, in the case that Aiden is unable to. The mother may also be able to help guide the education sessions with ideas of how best to engage Aiden, so that he stays present throughout the entire education session. It's also really important for his mom to understand how to completely manage Aiden's diabetes in the case that Aiden is unable to. As well as the complications that could potentially arise if his diabetes are not managed adequately. The next person for his team would be a school counselor. The school counselor will be able to provide Aiden with emotional support. They will be able to provide him with age-appropriate coping techniques and aid in Aiden's education sessions regarding ways to keep Aiden engaged during those educational sessions. The next person I have listed is the unlicensed assistive personnel. Considering this was mentioned in the beginning of the case, that the UAP is the person that will be sitting with Aiden and watching him do his insulin bolus. It's incredibly important for Aiden to have the UAP understand his care plan, his most up-to-date care plan, so that they are able to help manage his diabetes with him. The UAP will also be assisting Aiden with his insulin boluses before lunch and helping Aiden in managing his diabetes. They can also encourage Aiden to become more independent in managing his diabetes, and again, must be kept up to date with his most current care plan. And then the last person I have on here for his team is his endocrinologist. The endocrinologist will help manage Aiden's diabetes and monitor his HbA1c levels, adjust his care plan and insulin schedules and dosing as needed, and will also be able to give insight into what Aiden could possibly do differently to help manage his diabetes a bit better. And the information I got to help with this section was from Scannell and Ruggiero 2022.
And what immediate interventions can you implement to assist Aiden with glycemic control?
The immediate interventions that I would implement to assist Aiden with his glycemic control, the first one would be to immediately administer the correction dose of insulin based on his current blood glucose level. So the first thing we want to do is make sure that we can get his hyperglycemia under control. And so that would be the correction dose. I believe it was 0.5 units per something per kilogram. And then the next intervention that I would do would be to ensure that the UAP is monitoring Aiden's blood glucose levels closely, and also supervising Aiden when he administers his lunchtime insulin bolus until his blood glucose levels stabilize. Even after that, the supervision should probably be continued for his insulin boluses. We just want to ensure that he is in fact getting the proper dose of insulin to cover his carbohydrates for lunch. We also want to monitor Aiden's blood glucose levels every 2 to 4 hours until they have stabilized. This is super important just in case the amount of insulin that he did receive wasn't enough. We would be able to have a rapid response to that complication. And then the last one I have here for interventions for glycemic control is monitoring Aiden's HbA1c levels every 3 to 6 months, or as prescribed. This would be done more by his endocrinologist, and the endocrinologist will be able to relay that information about his HbA1c levels and recognize those trends that go with those. And to help with this section, I got my information from Scannell and Ruggiero 2022 and Lippincott and Visor 2024.
All right, and what is at least one other intervention you can provide to Aiden for health promotion and maintenance?
So another intervention that I can provide Aiden for health promotion and maintenance would be to introduce a carbohydrate counting tool, or possibly an app if Aiden has a phone. Considering Aiden has dyscalculia, it may be difficult for him to count his carbohydrates and calculate the correct amount of insulin he needs. So introducing a tool that can simplify this process, like selecting foods from a list that automatically calculates the amount of carbs, would be very helpful. And then the needed insulin that goes with that amount of carbs will definitely aid Aiden in becoming more independent and adequately managing his diabetes. It's very imperative to take his dyscalculia into consideration, because even if Aiden is aware of the correct amount of carbohydrates in his food that he's eating or will be eating, his mathematics may still be off. So having a tool or an app would be very beneficial to ensure that his calculations are correct and adequate. And to help with this, I got information from Witzel et al. 2018.
And what are 2 ways you can measure outcomes for Aiden?
So 2 ways to measure outcomes for Aiden would be his blood glucose level and HbA1c trends. So this will measure outcomes for his diabetes control. So being able to see the trends of the HbA1c and blood glucose will let us know that Aiden is in fact managing his diabetes effectively. And then the next outcome I have is have Aiden do a teach back session. During this teach back session, Aiden can show us that he can appropriately manage his diabetes for one whole day. This may include checking his own blood sugar levels, responding to any CGM alarms if they do arise, calculating his own lunchtime insulin bolus, and being able to show us that he can also administer that lunchtime insulin bolus. We can provide Aiden with a log that may help him continue to stay on track with his diabetes management. This log may include the foods that he's eating, the carbohydrates that go with that, and then the amount of insulin the insulin bolus that he gave himself. And then the information to help with this I got from Scannell and Ruggiero 2022 and Whistle et al. 2018.
Great. And our total references are Healthy People 2030, No Date, Social Determinants of Health. Is that one of them?
Yeah, I did.
Oh, Child Anxiety Counseling in Davidson, ACAD 2022, July 18. Do kids grieve differently than adults? And Harding, Kwong, Hagler, and Reinich 2023. That's Lewis Medical Surgical Nursing Assessment and Management of Clinical Problems, 12th edition, Elsevier. And then
Don't read the ISBN.
no. And then Lippincott Advisor 2024, Hyperglycemia Discharge Instructions, Child, retrieved August 14th, 2024. Lippincott Advisor Methylphenidate, no date. Witzel, B, and Mize Mini 2018, Meeting the Needs of Students with Dyslexia and Dyscalculia. And then Scannell and Ruggiero 2022, Maternal Child Nursing Care, 3rd edition, F.A. Davis.